Part 1 of this program discusses the Consolidated Direction on Occupational Health and Safety Measures in Certain Workplaces, specifically focusing on Section 3, Risk Assessment and Plans for Protective Measures. So what does the Consolidated Direction on Occupational Health and Safety Measures in Certain Workplaces state for employers? Well, all employers must make a decision whether they intend to make vaccination mandatory. They should do this within 21 days of this directive coming into place. That was on the 28th of May 2021. They need to take a look at these amendments. They need to make sure that it is in accordance with Section 8 and 9 of the Occupational Health and Safety Act, as well as taking into account their own company's operational requirements for their own specific workplace. If they do make it mandatory, they must then identify those employees who, by virtue of the risk of transmission through their work or the risk of severe COVID-19 disease or death due to their age or comorbidities, should be vaccinated. This type of risk assessment then helps them to develop a plan or amend their existing COVID-19 plan. This plan must outline the measures that the employer intends to implement in respect of that vaccination. As well as in accordance with this directive, it must take into account the guidelines in Annexure C, which we'll discuss in the next few minutes. So does this mean then that you can be forced to take the vaccination? Well, absolutely no. The Constitution of the Republic of South Africa, Act number 108 of 1996, states under Section 12 that a person has freedom and security. This means that everyone has the right to bodily and psychological integrity, which includes the right to make decisions concerning reproduction, to security in and control over their body, and C, not to be subjected to medical or scientific experiments without their informed consent. Now, according to the Consolidated Directives under Section 3.4, employers are to take into account the rights of their employees to bodily integrity according to this Constitution as set out. All employees have the right to freedom of religion, belief, and opinion. However, employers are required to take this whole process into action to ensure that as a whole, as a group, their company is kept protected. And thus, you might be identified as an employee who requires the vaccination. This does not necessarily mean that you must be vaccinated, but something must be done to mitigate the risk of transmission between yourself and other employees or clients that might potentially come into contact with you. So there might be some adjustments to your work. But please remember that the employer is looking for the best and fairest way of dealing with these directives. The purpose of this directive is to ensure that all employers are taking reasonable and fair steps to ensure that all employees, as well as others who may be affected by their work, are protected by exposure to COVID-19, as well as doing their part to make vaccination mandatory or make alternative arrangements to prevent and suppress the spread of the COVID-19 virus. But what is the COVID-19 vaccine? Well, a COVID-19 vaccine is a vaccine that has been scientifically evaluated and recommended by the World Health Organization, as well as approved by the South African Health Products Regulatory Authority to be effective in preventing severe disease and death, and likely to reduce SARS-CoV-2 viral transmission in order to contribute to herd immunity. Now, herd immunity occurs when a large portion of a community, the herd, becomes immune to a disease, making the spread of disease from person to person unlikely. As a result, the whole community or herd becomes protected, not just those who are immune. Now, how do employers treat their employees with fairness, and how do they go about ensuring that these directives are implemented in a proper manner? Well, that is why the Annexure C of these directives have been given to you. The first thing stating that all employers must determine the fairness of a mandatory vaccination policy as well as its implementation. The second is to note that these directives are general and the size and nature of the business may warrant a different approach. That is why it is key to get a risk assessment done. These guidelines are not a substitute for collective agreements or agreed procedures. And so again, they are encouraging good communication between their staff as well as potentially others who may have an impact on their company. Then the key principle of these guidelines is that employers and employees should treat each other with mutual respect. And we cannot state that enough. In fact, let's read that again. Point number 4, the key principle of these guidelines is that the employers and employees should treat each other with mutual respect. Now, point number 5 says subject to the agreement. So subject to these communications and the agreements that you come upon, the plan must state that the identified employees must be vaccinated when it becomes available for them. The right of the employee to refuse based on the Constitution, and the opportunity to have discussions with the Occupational Health and Safety rep or any union that they may belong to. Point 6 of this directive states that employers should, if it is reasonably practicable for them, transport their employees to and from the vaccination site as per the EVDS registration portal. Point number 7 states that should an employee suffer from side effects, they must take paid sick leave in terms of the basic conditions of employment, or perhaps any applicable collective agreement that you have come to, or lodge a claim for compensation for occupational injuries and disease. Now, if the employee refuses to be vaccinated, point number 8 states that an employee must be counseled and, if requested, allow that employee to seek guidance from an occupational health and safety rep or a union. It is important to refer the employee for further medical evaluation should there be a medical contraindication for vaccination. Now, if necessary, take steps to accommodate the employee in a position that does not require the employee to be vaccinated. What does it mean to have reasonable accommodation? Well, it means that you may modify or adjust that person's job or the working environment to allow that person who refuses to be vaccinated to stay in employment, but it helps to incorporate the relevant proportions of the Code of Good Practice from the Employment of People with Disabilities in the Employment Equity Act. This might include adjusting or permitting the employee to work off-site or at home, or in isolation within the workplace, such as an isolated office or an isolated area within a warehouse, or perhaps working outside of ordinary working hours. In any instance, we want to ensure limited contact with others in the workplace. This might also include a requirement that the employee has a mandatory N95 mask at all times. What if you are unsure about the vaccination or what to do in order to get or not get vaccinated? Well, the first thing you want to do is get more information to help you make an informed decision. You can communicate your concerns to your employer and then look for a fair and reasonable solution. Do your research. What are the vaccines? What are the side effects? What are the benefits? This will help you to become more sure about the decision you are going to make. What if your employer has already made vaccines mandatory, but you disagree with this decision? Well, the first question to ask yourself is, why do you disagree? Is your disagreement based on research, personal opinion, something else? Is the mandatory policy of your company based on a solid risk assessment? Has the employer communicated with you regarding the risk assessment findings? And a very good question to ask yourself is, do you agree that everyone needs to take steps to protect the larger group, the herd of employees, including yourself? Let's recap. All employers are required in terms of this directive to make a decision within 21 days of this directive coming into enforcement whether it intends to make vaccination mandatory. And if it does, they need to identify those employees who must be vaccinated. This will move along with a risk assessment as well as a COVID-19 management plan. Now, on the basis of this risk assessment, an employer must either develop a plan or amend an existing plan. They are to outline within this plan the measures that they intend to implement in respect of the mandatory vaccination policy, as well as taking into account these directions as well as the guidelines in Annexure C of these directives in order to be fair. So we mentioned that you cannot be forced to take the vaccination. Well, what does that mean for employers and employees together? Well, when you consult on discussing how you're going to implement this plan, we need to look at reasonable accommodation. This means that you modify or adjust a job for a person or perhaps even the working environment. This will allow an employee who refuses to be vaccinated to remain in employment, but it also helps to incorporate the relevant portions of the Code of Good Practice from the Employment Equity Act. This might include things like adjustments that permit the employee to work off-site or at home or in isolation within the workplace, such as an isolated office or an isolated part of the warehouse, or perhaps even outside of ordinary working hours. Now, in instances of limited contact with others in the workplace, it might include a requirement that the employee wears a mandatory N95 mask at all times.